Okay. Let me ask you, Mandy, one more time. You sound pretty good today. What's the success part of this story?
Well, a diagnosis and a doctor that believes in chronic Lyme.
And that doctor in your case was?
Dr. Joseph Demsek.
And the treatment that you received that has been successful?
For me was 1 year of IV therapy and then switching over to orals, and I continue to do maintenance orals now.
So and when you say IV antibiotics?
That is correct.
On a how constant a basis?
Every day. 5 days a week.
For a year.
Correct.
And then we've gone several years since then with oral.
Yes.
Okay. So in other words, you have taken antibiotics for how many years?
Long term. 4.
4 years. and I know that I got emails actually today from someone who said, I've been taking them for 10 years, and if I go off them, the symptoms come back. So there's something which, one thing that it's taken Americans a long time to figure out is that they shouldn't take antibiotics profligately. And so now that bit of wisdom, I think, is what leads some people to say, oh, well, that can't be a safe treatment, because we learned that that's not so. Okay.
Well, I would say that we need to change the way that we look at medicine in many ways.
Exactly. I'll tell you what, we want to call Mandy and Dr. Horowitz back because we're having a little trouble with that line. So at this moment, let me bring in Dr. Lorraine Johnson. And Lorraine Johnson is an attorney with an MBA. She's the CEO of the California Lyme Disease Association, a member of the board of directors of the International Lyme
and Associated Diseases Society.
And Associated Diseases Society. She's spearheaded an unprecedented legal campaign aligning with the Connecticut Attorney General to challenge the guidelines under which some of the confusion reigns. So, Lorraine Johnson, what is the situation? I haven't even talked yet about the role of the guidelines that have led to your legal challenge, but please lay out that story for us.
Yes, this is an interesting story, and I think it's one that's going to become more prominent in healthcare as we go along towards the quest for universal healthcare. And that is that we have a set of guidelines that deny patients treatment for chronic Lyme disease. These guidelines don't recognize the existence of chronic Lyme disease. So when patients have the type of symptoms that Mandy's complaining about, they can't turn anywhere for help. They have a very hard time finding a physician to treat them.
Okay. And so in this case, let's deal with this one. But I really agree with what she's saying. One of the tricky things in the movement toward universal health care is that we have healthcare costs out of control, so people are looking for ways to save. And one of the things that seems to make eminent sense is let's look at what really works and what's effective. The tricky thing with that is who's going to make those decisions and who are those decisions going to favor, et cetera, et cetera. The guidelines we're talking about in terms of Lyme disease, who sets them, how are they set, and what's the problem with them?
The guidelines have been set by the Infectious Diseases Society of America, which is one of the largest medical societies in the world. In fact, they pretty much control the treatment of all infectious diseases. They have the 2 largest medical journals. They have a lot of power and influence, and so what they say tends to go. And their treatment guidelines right now do not recognize chronic Lyme disease, and those patients have a very hard time getting either treatment for their disease, diagnosis for their disease, or coverage by the insurance companies.
Okay, so how does it happen that a infectious disease society sounds like someone we should trust, sounds like the best and the brightest, says chronic Lyme doesn't exist, and we are dealing with patients who know it exists?
Well,
and doctors who know it exists.
Well, part of the problem is we don't have good diagnostic tests. So when you don't have good diagnostic tests, you can't definitively say whether a patient has cleared an infection or not. That leaves a whole door open to controversy. So if you get a group of people who say, no, you're absolutely cured and whatever is going on with you now is some sort of post-Lyme disease syndrome. If you weren't cured with 30 days of antibiotics, you have another disease, or we don't know what you have.
In other words, we know what Lyme disease is. Mm-hmm. We know how to cure it. Mm-hmm. You've had that treatment, so if you're sick now, it's something else.
That's right. And part of the problem is that the guideline development panels, these days, a lot of them are really populated by research, academic researchers. And academic researchers...
You're saying versus clinical doctors.
Exactly. And so academic researchers have a really strong expertise, but one of the things they do is they do research. And research is all about narrow disease definitions. So you get a group of researchers sitting around developing treatment guidelines for patients. It can be a disaster if they don't see the full clinical spectrum.
Okay. And one of the things I mentioned at the top in the introduction was that the primary blood test for Lyme's disease can, according to the film, produce up to 50% false negatives?
And that's true. The problem with a treatment, with a diagnostic test, is just it's a very big problem right now. And the IDSA guidelines require that you have a positive test in order to be diagnosed. So if you have a faulty test and you're requiring that patients have a positive result on that, you're going to miss a lot of patients. And that's what happens. Patients get misdiagnosed with this disease.
Well, I mean, this seems crazy to me. Mm-hmm. If you know, do the folks who have set the guidelines, does that association admit that there's a lot of false positives? And if so, how can they leave in their guidelines that you don't have it unless you test false negatives? How can they do that?
I think most of the people in the IDSA believe that the tests are better than the research actually shows them to be. And this is evidence-based medicine, and evidence-based medicine, there's going to be research on one side and research on the other side. A lot of times we think things are going to be black and white, and they're not. There's these gray areas. And the question is, how do you navigate these gray areas when the tests are not as good as you need for them to be, and patients are sick and suffering? You really need to be able to have the clinical ability to diagnose and treat patients, and guidelines need to be very careful about taking away treatment options from patients. Patients are not sitting on these guideline panels, and so what happens when you have a guidelines panel that sits down and comes up with a set of guidelines, they're not necessarily considering this from the viewpoint of the patient. They're considering it from the viewpoint of the researcher.
Yeah, okay. Let me bring in first Dr. Horowitz and then Mandy to chime in on what Lorraine Johnson has said. And before you do, let me tell people, I'm Terry McNally, and we're speaking about Lyme disease and under our skin. And I think this is a timely topic, actually, right now, because we're going into summer. People are going to be hiking more. And I'll tell you what, before I speak to Dr. Horowitz and Mandy, let me just ask Lorraine, who's local, are there ticks in Los Angeles?
Yes, there are.
And I've heard Malibu in particular.
Yeah, Malibu is an endemic area. And Malibu, the thing that's lovely about Malibu is they've actually gone out and done the tick studies where you collect the ticks and you test them. A lot of areas of Los Angeles have not had those tick studies done.
So the fact that we know Malibu is maybe partly because they've studied. So in other words, what you're saying is, what should people do if they're in the local area? They should be vigilant. What should they look for? How should they protect themselves? And then I'll come back to you, Doctor and Mandy.
Well, they should make sure that they're wearing socks, that they're keeping themselves covered when they can use a tick repellent on their clothing. And when they come home, they need to make sure that they're doing a tick check. And the way that you're going to spot a tick typically is going to be by feeling it when you're in the shower. They're very small. They're the size of a period at the end of the sentence.
Oh, I didn't realize that.
Yes. The ones that infect are the nymphal ticks, and those are very small. So a lot of people aren't even aware that they've been bitten.
Oh, my God. Okay, so if you're within the sound of my voice, as they said, it's now in all 50 states and every continent, but I know that this is a problem that many people think, mainly on the East Coast, mainly in New England, and Malibu is one of the most dangerous places, correct? Well,
Malibu is an area that has quite a few infected ticks, and they've done the studies there. Up in northern California is a highly endemic area.
Oh my God. Okay, so you've got to pay attention to this. The repercussions are so severe. Dr. Horowitz, anything about what I was talking to Lorraine Johnson about in terms of the Infectious Disease Society, the guidelines, etc.?
Yes, I completely agree with Lorraine. The problem is this narrow research definition of saying that chronic Lyme doesn't exist. There's nothing that could be further from the truth. But in this research definition, what's interesting about it is, again, they only talk really about Lyme disease. When my patients come in and they're ill, they don't just have Lyme. they have Lyme, and they have Ehrlichia, and they have Babesia, and they have Bartonella, and their hormones have all been thrown off, which a lot of the doctors don't check for because the pituitary gland gets hit by Lyme. So the men have low testosterone, and they have low libido, and the women are having problems, and their thyroids are off, and their adrenal glands are off, and they've got a host of other environmental things that have happened to them. So, as a board-certified internist, we always look for the whole host of how to get someone better. It's not just about one bug, but this narrow research definition makes it sound like that's the answer to the whole problem. Is just the disease just exists in this limited form, but it's much more than that.